So my name is Andrew Srisuwananukorn, and I'm a physician at Ohio State University at the James Cancer Hospital in the section of leukemia. And my clinical focus is a niche chronic blood cancer within the realm of myeloproliferative neoplasms. And these diseases are chronic diseases that patients can live with for years to even decades. And I'm happy to talk to you about my approach for one of the myeloproliferative neoplasms called myelofibrosis. Now, I understand these diseases are quite rare, and likely a lot of you have never even heard of this disease before, and that's okay. I'll be starting with the basics. So, for today's talk, I'll be talking about a general overview of all the myeloproliferative neoplasms in regards to their biology and epidemiology. I'll furthermore go with a case presentation and give practical management points and give a couple paradigms about how other experts and myself think about upfront treatment for myelofibrosis. And finally, I'll be giving a brief overview about what we're excited for in the next generation of novel therapeutics in this disease space. So first, a general overview of these diseases. The myeloproliferative neoplasms. Now, the first disclosure is that CML, or chronic myeloid leukemia, technically is one of the myeloproliferative neoplasms, but the biology is so significantly different that I will not be talking about CML today. Instead, I'll be talking about the other classical myeloproliferative neoplasms, including polycythemia vera, essential thrombocythemia, and primary myelofibrosis. Now, these three diseases are all related and they have different phenotypes. Polycythemia vera, or PV, typically a patient has elevated red blood cells. And in essential thrombocythemia, or ET, patients have elevated platelets. Now, myelofibrosis is a little bit different. Patients tend to be very symptomatic, which I'll go into, and patients actually have low blood counts, low hemoglobin, low platelets. But the reason why these are all related is because they have the same pathophysiology behind it with the same driver that's causing these diseases to exist. I'll be talking specifically about JAK2, MPL, and CALR, but they all have the same underlying biology. Now, to make a very important point, because I understand that these diseases are all very confusing, you may have heard of certain types of acute myeloid leukemias, or AML, or other conditions like myelodysplastic syndrome, or MDS, but MPNs are not that. So unlike MDS and certain AMLs where their counts are low, MPNs, the P meaning proliferative, the cell counts are actually very high. And I want to highlight that point again with this paradigm that I've created, because these diseases are confused each other all the time. And as I mentioned, myelodysplastic syndrome, the D, dysplastic, means things don't work. You have ineffective red blood cell and platelet production. And these patients with MDS, they have low blood counts, low hemoglobin, low platelets. Completely contrast that with what I'm talking about today, myeloproliferative neoplasms. The P meaning proliferative, things are high. There's mature cell overproduction with increased red blood cells and increased platelets. Now, it is true that I'll be talking about these diseases might change, and there might be a lot of scar tissue from these diseases that leads to low red blood cells and low platelets. So there is a transformation that kind of looks like MDS. And even more confusing is a third completely separate category called MDS MPN overlap syndromes that have features of both conditions where their blood counts are low and high at the same time. And these three conditions or families are different. Commonly, they all can progress to a secondary form of acute myeloid leukemia, but that's kind of where the similarities stop. So as a brief reminder for today, I'm not going to be talking about the left two. I'm not talking about MDS or MDS MPN overlaps. I wanted to focus on the myeloproliferative neoplasms, specifically one called myelofibrosis. So epidemiology amongst these three diseases of PV, ET, and myelofibrosis, these are rare chronic blood conditions at a rate of 3 to 11 per million person years. And as you can see on the bottom left, it tends to be a disease with the age of onset is later in life, with peak incidence at around age 80, as highlighted by that vertical line that I've created. On the right side is the rarity or the incidence across the decades, 2000 to 2012. And you'll see that across these diseases, myelofibrosis is the most rare at about 3 cases per million person years.